Hi guys, this is Becky Smith, your Intro to Clinical Lab Science instructor. Today I'm going to go over a lot of things with you since it's your first day of class, and as you are watching this with your sub Leah, I'm actually in surgery at Aurora Baycare here in town, so a few prayers sent my way would definitely be great. My goal is to be back with you guys by Tuesday of week 3. There's a small chance I might not be, but let's hope for that. If not, you'll have Leah for week 3 as well. So a few things that I wanted to start with is I wanted to talk about your online class and who your instructors are. Again, I am Becky Smith, your program coordinator. I have met with all of you at some point in time, but you also have an online instructor for the Intro to Clinical Lab Science course, and her name is Becky Tao. So we end up having some bit of a confusion as to who their online instructor is and who their lab instructor is. So if you look at the screen that I have here in front of you, you'll see you have these two courses as well. The first one is Section 1, Intro to Clinical Laboratory Science. This is your main lecture course that is taught by Becky Tao from Mankato, Minnesota. You are going to be enrolled in this class with other campuses such as St. Cloud, Minnesota, Lake Elmo, Minnesota, Moorhead, Minnesota, and Mankato, Minnesota. When you look underneath that, you have another section called GRB-B1, Intro to Clinical Laboratory Science Lab. This is where you'll be submitting your laboratory reports. This one is going to be what I am working with you on. Okay, so when you have me or Leah the first 3 weeks, your labs are going to be put in the Dropbox within your lab section. All of your written assignments, all of your quizzes, your PowerPoints, information from the main laboratory or the main instructor for clinical lab science will be in the top lecture section. So for example, next week you're going to have a quiz on this week's PowerPoint material that I'm going to present to you today. And this is the section you will do that in. So why do you have two sections? That sounds kind of redundant, right? Well, the reason being is you have to not just pass all of your lecture material, you also have to pass the laboratory material. You have to get a 73% in both sections in order to pass the course. So in history, what has happened is students would not show up for 3 labs or 4 labs, do very poorly on their labs, still pass the course because they did very well in the online section. We need to make sure that you are competent in both the lecture section and the laboratory section before we allow you to move on to the next courses. I hope that makes some sense for you. If you need further clarification, you can certainly email me. I will be replying to emails by week 2 for sure. All right, so here's what the inside of your class is going to look like. I'm going to go ahead and click on your online class. You have this. Here's a pretty picture of Becky Tao. You can see we look nothing alike. In the online courses that you have with me and email correspondence with me, you will see me referred to as Rebecca Smith. Okay, she will always be referred to as Becky. So if Becky and Rebecca helps you, by all means, go for it. Okay. Sometimes Becky likes to throw these course polls in here. They're just for fun or some information that she would like. When you click on your Lessons tab, you're going to see a whole bunch of stuff in here. One thing Becky is going to refer to is this program assessment up here. Okay? When you click on this, it's an ungraded pre-test. So what you're going to do is you're going to go in and it's going to look different for you. You're going to get one question at a time. And you're going to go ahead and take this test. It's going to be terrible and you're not going to know any of the answers, but just go through and take it. We use this test and a post test, which is very similar but a little bit different, and we give that to you at graduation. So we need to compare this test to the end test to make sure that you've learned everything that you were supposed to. So when you see that, you'll hear Becky Tao referring to that. That's what she's referring to. All right, so let's look at Module 1 because that's what you're going to be doing this week. And when you open Module 1, you're going to see a bunch of stuff in here. You can have some course objectives. Of course, it's going to tell you everything that you're going to learn this week in class. The next section is a list of all of your materials that you'll need to do. So it's got all of your assignments and things. The next is a list of your PowerPoints, which I'm going to be going over 1-1 and 1-2 with you. You're going to have a little interactive piece on what each of the different laboratory departments are. So as you go through these, you can roll over and it'll kind of tell you what is done in each of these departments. I can tell you these are very important, and these types of things will be on your quiz and exam. Here's a recorded lecture from Becky Tao. When you click on this, it will start playing her lecture, okay? So the things she goes over might be a little bit different. So you want to make sure that you pay attention and take notes to things I do in class, and you watch her lectures as well. Here's your written assignment. Watch a show such as CSI, House, NCIS. The best way, you can actually find full episodes online of these. If you have Netflix, Hulu, things like that, they're very easy to find as well. So go ahead and watch one of your favorite shows and write a 3 to 4 paragraph summary answering these questions here. You are then going to save it and submit it to the Dropbox below. Your discussion is about professionalism in the healthcare field. So you're going to want to read this, do a post, and reply to a few of your fellow students. Note, you're going to have more than just the 4 of you that are in class. You're going to have all Rasmussen Intro to CLS students in the course with you. The lab activity is included in here, but this you are going to want to submit to your, what do you call it, in your lab section. Sorry, Becky Tao will still grade that, but it's going to go in there. And while I have this here, I'm going to go over this with you. Leah's going to give this to you at the end of class, but let's just take a peek at it. So what you're going to do is you're going to look at 3 different types of societies that are included in laboratory science. So some of the choices on here, and I'm sorry this is taking a minute here. Let me try this again. Come on, lab activity. This looks like it'll work. All right, so Leah's going to hand this out. She can probably hand it out to you right now as I'm talking, actually. But there's going to be different societies and programs listed on here. You are going to choose 3 out of the 8 or 9 that are on here and write a quick paragraph about each one. And this is really taking a while. Okay. All right, I'm going to go ahead and close this. I'm not going to make you guys wait and watch that open. So when you click on your Module 1 lab activity sheet, you're going to open it up. Open it from here, and there's hyperlinks to different societies. You're going to pick 3 and write a paragraph about each one, okay? That you're going to submit for your lab activity for this week. All right, so again, your Dropbox is going to go in the lab section. All right, so let's go back and to go through some of these PowerPoints. Leah is going to hand out the PowerPoints for this week. And they are in the PowerPoint presentation file. Let's see if this takes as long to download as the Word document was trying to. All right, perfect. This looks a lot better. Okay, so here is our PowerPoint for section 1-1, Introduction to the Clinical Laboratory. I could have had Leah go through these PowerPoints with you and she would have done a fine job, but I want to go through some of this so I can share some of my own personal experience and make sure that you get the information that you need. Okay, so I'm going to skip past that first slide because it's just about objectives. But the first part is clinical laboratory regulation. Prior to 1988, there was not a lot of standards within the medical laboratory. People could pretty much do what they want. In 1988, CLIA, the Clinical Laboratory Organization or agency, set minimum standards for a laboratory. So here's an example as to why CLIA needs to come into place. I can't just go to the mall and set up a kiosk doing cholesterol testing. I would need to have, at bare minimum, a CLIA certificate to make sure that I have been looked at, that I'm doing things appropriately. So even though I've got all the equipment here at Rasmussen, we can't do a big student fundraiser and go to the mall and start raising some money. We would need to be regulated for that. There's also the Centers for Medicare and Medicaid Services. They're always trying to make sure that we're not overcharging or undercharging. States are also very, very stringent. Their regulations must be as stringent as federal, and they must not violate federal regulations. There's a lot of things that the state of Wisconsin does to make sure that we are doing things appropriately in the laboratory. As you can see, we have many different types of laboratories, with the most of them being, surprise, surprise, in a physician office laboratory, or POL, that you see here on the right. The second biggest is other, and hospital only accounts for 4% of all laboratories. So when you picture yourself after graduation working in a hospital laboratory like Bellin or St. Vincent or Aurora, that's only 4% of the jobs that are out there. There are many different opportunities for you to work as an MLT and not just in the hospitals. So physician office laboratories are more like your clinics and such. So when you are in a hospital laboratory, we have an organizational chart. So this is referring to the whole hospital. The next slide will be more focused on the laboratory. So all hospitals, you're going to see there's this board of directors up here. They kind of help make decisions on what is good or not good for the community and the people, the patients for the hospital. You have a CEO that helps organize all of these other areas. Also, the CFO, medical staff, and some other public relations people are involved. Now you see all these different departments. We usually fall under clinical services. You'll find us down the same hallway, usually, with imaging, respiratory therapy, occupational therapy, something like that. Pharmacy, sometimes we're pushed on those sides. Nursing is almost always in their own little world here. I'm sure Leah's rolling her eyes at me, but there's always some nursing services. We're always put with all the other diagnostic services, sometimes put under diagnostics. We have physician services. We have some other support services that are important. Environmental services like janitorial, nutrition, the chaplain, social services, central supply, etc. We also have all of the billing people. And there's more than that too. Like I said, I could go on and on forever about the different areas of the hospital. Other types of non-hospital laboratories, we talked about physician office laboratories, reference laboratories are huge. The federal CDC, Center for Disease Control. When you hear about, oh, influenza is heading towards Wisconsin, or, oh, we've got a bird flu outbreak down south, the CDC is responsible for following those diseases and reporting those out, okay? If you ever think of like anthrax and those really highly contagious things, SARS, what are some other ones, Ebola, CDC does have those things stored in their facility. So it's kind of a highly lock and key type of place, very fascinating. It's public health laboratories too. Here's for the Center for Disease Control again. But again, it helps educate and watches the epidemiology of the spread of disease. So let's talk about these classifications of tests. We have the waived tests, moderate to high complexity, provider-performed microscopy, and the Food and Drug Administration. So what these mean, the waived tests are tests that just about anybody can do, and if you screw it up, you're not going to kill somebody. Now, it doesn't have that in the definition of waived, but if that helps you memorize it, all the better. Places where waived tests are done would be in emergency rooms, sometimes patient bedsides. Medical assistants can perform them. Physicians can perform them. Nurses can perform them. So things like pregnancy tests, glucose tests, some cholesterol testing, things that are very relatively simple to perform, but cannot cause patient harm if done inappropriately. Well, we are putting you through the Medical Laboratory Technician program so that you can perform moderate to high complexity testing. This is the type of testing that, if done inappropriately, could cause harm or even death to a patient. So we, as we go through the MLT program, talk about patient safety and perfection as much as possible, because we could potentially cause a serious error if we're not very careful. Blood bank is a perfect example. Does anybody know what happens if you give somebody the wrong blood type? The tech tested the blood, got the wrong type, entered it in the computer, was lazy, grabbed the wrong type of blood, did more cross-matching on it. You kill the patient very quickly. Okay, so we have to be very, very careful. You are going to be able to do this moderate to high complex testing, and you have to do it with nothing but perfection. Provider-performed microscopy procedures are done in a physician's office, sometimes right in the patient's room. I know when I worked in Stevens Point at the clinic, UW Stevens Point Clinic, the doctors all had microscopes in their offices, and they would do things like wet preps under the microscope to look for yeast infections, and they did all kinds of things like that. So they're able to actually look under the microscope. FDA, they are responsible for things like the blood bank. People don't think of needing something in the laboratory monitored by the FDA, but blood products are actually considered in that drug category because we do administer them to patients. So if you do decide to open a kiosk and do some type of testing somewhere, you're going to need some type of a certificate. You could have a waiver, which is the easy test that you can't really kill anybody. A registration, certificate of registration, certificate of compliance, accreditation, and those just provider performed microscopy. So some physicians just have their own microscopy certificate. So here's the laboratory organizational chart that I talked about 10 slides ago, stating this chart was next. Well, it's not next, it was 10 slides later. Anyways, every laboratory has a laboratory manager, as you can see in the top green one here. And on the other side, an associate director, usually of professional development, some other management type things. We'll have a technical director, maybe a program director for clinical laboratory services. You might have a quality assurance coordinator. Again, it depends on how large the laboratory is. If the laboratory is not very big, you might just have a lab manager who does all of those things as well. And in addition to the laboratory, a lot of time there's anatomical pathology. This is where, when you remove body parts, where they bring them to be looked at by a pathologist. We refer to the pathologist as the doctor's doctor. So the surgeon is up and he's removing lymph nodes from someone who may have breast cancer, sends them to pathology. Pathology will look at those lymph nodes to see if the cancer has spread. If it seems like the cancer has spread to those outside margins of the lymph nodes, the pathologist will call the surgeon and say, dig deeper until you get more. So that type of relationship. When a doctor tells you have a certain type of cancer, pathology is very closely involved to help diagnose that patient. Some other things we have, I'm going to run down the list here. Personnel and staffing, you may have some specimen processing under that. I'll kind of lump those together. You may have a secretary answering the phone. You may have somebody separating serum and plasma and sending things to different departments. Going down on the left-hand side again is laboratory information systems. That is somebody who's in charge of the computer system. Then we have immunology, which is below that. That is the study of antigens and antibodies. You guys are all going to be working with a certified background check, which I'm going to talk about after all of this. And you need to get your immunizations entered. Well, if you need to have your blood drawn for a hepatitis B titer, immunology is the department that would do that. We also have some types of ancillary testing, such as point of care testing that is done at the patient's bedside. Picture nurses doing finger stick glucoses on patients. All right, let's hop over to the right column. Transfusion services, also known as blood bank or immunohematology. That is where we deal with blood products from like the Red Cross, for example, to give to patients. Chemistry and special testing, we check for things like glucoses, kidney function, liver function. Molecular diagnostics is the fastest growing department of the laboratory. This is where we do DNA type testing using polymerase chain reaction for the most part to target certain sections of DNA to get a diagnosis a lot faster. For example, it used to take us 2 days to see if somebody had methicillin-resistant Staph aureus. We can now get that test done in under 2 hours using molecular diagnostics. So rather than having to actually wait for that bacteria to grow, we can isolate a certain part of its genetic code and multiply that many times to get an answer a lot faster. Microbiology, it's my students' favorite. They all love to grow bacteria, look at it, do biochemical testing on it to see who done it, see what's making the person sick. Not only can we check the bacteria to see what kind is growing, we also subject that bacteria to different types of antibiotics and different concentrations of antibiotics so we can tell the physician what type of antibiotic works best for the infection that that patient has. The next couple on here, urinalysis and hematology. Hematology is the study of heme, which is red blood cells and cells in the body. We can tell the physician how many white blood cells, how many red blood cells, what percentages of each type there are so that they can help diagnose the patient. Then urinalysis kind of stands out on its own. That one is, we tested the urine for just about everything under the sun. All right, so we're going to look at some of these personnel. We have a laboratorian doing some urinalysis down here. But again, you have the laboratory director and pathologist. You may have a technical supervisor underneath the director who's kind of in charge of the different areas of the lab. You may have a general supervisor or a department head, and then of course the testing personnel, which would be you. We just went through all these departments, so I'm not going to go through them again in detail. This is a picture of a laboratory. Okay, this is a pretty typical one, I would say. This would be like the size of a section of Aurora's laboratory. It's not real big, but you can fit a lot of analyzers in a small space if you're pretty creative. We talked about microbiology support services, the laboratory information computer systems, and the point of care testing that is done right at the patient's bedside. Most things when they're ordered in a laboratory are entered into the computer system directly by the nurse or physician. The laboratory then gets a printed barcode, or the nurse's station will get a printed barcode to draw the blood sample and put the barcode on the sample. The sample comes to the laboratory, the analyzers read those barcodes. It helps decrease patient error significantly. One word you're going to hear us talk about constantly, especially in the clinical chemistry course, is quality assessment. We are continually evolving and expanding and looking at ways to make the laboratory as effective and efficient as possible while providing laboratory results that are absolutely perfect. There's nothing worse than providing an inaccurate laboratory result. So it's part of all laboratory activities. We are constantly running quality control and quality assurance to make sure all of the testing that we're reporting is amazing. Some of the ways that we are tested to make sure we're doing this is proficiency testing. So we get specimens from, like the state of Wisconsin, will send us unknown samples. They're little vials of liquid. And it'll say, okay, on tube 1, do an alcohol, do a kidney function test, and do a glucose. You know, it'll give you like 3 or 4 things to do. You have to run those tests just like you do your patients. And then you have to report those tests back to the state of Wisconsin. They then look at your results and you better get them right, okay, because they can shut you down if you don't. So that's how you prove to the state of Wisconsin that you are doing things accurately, by doing the proficiency testing they send you. Accreditation is another wonderful thing. There's the College of American Pathologists, there's CLIA, there's COLA, there's all different kinds of them. And if you become accredited, it shows people that you are going above and beyond to make sure things are perfect. So who's heard of HIPAA? You can't go to the dentist or doctor or anything without them asking you to read their HIPAA information. Privacy issues are very important, okay? There's a lot of testing that we're going to be doing in the laboratory, and a lot of things we're going to see before the patient even sees it. Maybe the patient doesn't want anybody to know, okay? So if there's an HIV test that's positive and you know the person, it's one of your good friends, you can't tell anybody. You have to keep that to yourself the rest of your life. I found out that people are pregnant before they did. So it wouldn't be fair if I went home and told everybody when they didn't want anybody to know. So you really need to keep things private. So with that, HIPAA came into place in 1996. It's a patient's right to privacy. There's confidentiality, and electronic health records are also kept private. Computers have made this easier and more challenging. Okay, it's a lot easier to access people's records nowadays than it ever was, because if you're in the hospital, you can look up anybody and anything who's ever been through there. I worked at Bellin Hospital. We did all the Packers labs. So every Packer player, we had access to all their history. You're not allowed to just go in and look at anybody's history. If it's not relevant to what you're testing, you cannot look it up. We had something called the Meditech Police at Bellin, and they would, if you're looking up, if you typed in Favre, I mean, this was back when Brett Favre was there, it's when I was at Bellin, it would flag the Meditech Police. So you have to be very careful. All right, so that concludes our first section here. I'm going to go ahead and pull up the second one, which I believe is a little shorter. So I want to get through this, and then I'm going to quickly go over your, let's see, immunizations. So I'm going to pull that out right now so that I don't forget. Because otherwise I'll say bye, and I will not get to it. Okay. All right, so we're going to look at the clinical laboratory professional. All right, so when you go back to the first in the history of laboratories, we're going back hundreds of years ago. Early medical laboratories were, of course, very archaic, and they did things like doctors would taste urine to see if it tasted sweet, to see if they had diabetes, things like that. So you can really go way, way back. But even as early as, or as late as, I guess I could say, the 1900s, we didn't start doing some very sophisticated testing where we're talking hundreds of tests an hour till probably the 80s. Okay, so that's not even that long ago. So modern clinical laboratories are they're just abundant there's a lot of analyzers is what I want to say. And that's so exciting to see how much can be done and how fast it can be done. So we've really come a long way. So the role of us as a laboratory professional, we're an allied healthcare partner. We work in many different settings and we have various levels of responsibility. So without us, the hospital would have a very hard time having the physicians diagnose patients, because we tell the physicians 70%, no, let me rephrase that. 70% of all medical decisions are based on laboratory testing alone. So use this as an example. 16-year-old comes into the emergency room on a gurney, unconscious, found on the corner of Main and Mason Street in Green Bay. What's wrong with him? What's wrong? Doctor's sitting there scratching his head. He's got respirations, he's got a pulse, temperature seems okay. Wonder what he did. He's not conscious, he won't wake up. Who can tell that physician what happened? The only person that can tell that physician is you. You're able to do toxicology testing, you're able to do cardiac testing, we can do testing to see maybe if you had a stroke, through a clot. Those are the types of things that we are able to tell the physician that nobody else can. So that makes your job extremely, extremely important. We have various levels of responsibility within that. You're an MLT to your MLT. Once you get a 4-year degree, if you keep going, then you're going to have more molecular diagnostics coming into play, and you'd have to learn more about that with that. One of the things that you're going to have after you take your boards is I don't have it on me right now, a name tag. You're going to have ASCP after your name. It'll say MT ASCP. Yours will say MLT ASCP. Mine says MT ASCP. So after you graduate from Rasmussen, we release you to take these boards so that you pass your test and you get the initials after your name. In order to take your boards, you have to graduate from an accredited college such as Rasmussen. We're accredited by the National Accrediting Agency of Clinical Laboratory Science, or NACLS. When you walk through our lobby, you can see there's a big picture, framed poster up there stating that we are accredited. So once, I should back up a little bit. You have a couple options of what your degree is going to be. You're going to see 3 different titles here. You are all going to be MLT, Medical Laboratory Technician, which is a 2-year degree. If you decide to go 2 more years, you will become an MLS. Okay, you'll have to take your boards again, take the MLS test, but this is considered a bachelor's level laboratorian. Okay. A few of us have this medical technologist degree, including myself. If you took your boards prior to 2004, you are an MT. So I'm an MT. I'm trying to think who else you'll have. Debbie and Scott down the road. They're MTs as well. MLSs are those that took the boards after 2004. With your education, there's different areas of specialization. So you could, when you're done with Rasmussen, you'll be able to work in hematology, chemistry, urinalysis. You could do all those things. If you really get into an area, like I'm clinical chemistry, I eat, live, and breathe clinical chemistry. I love it. I have a specialization certification in clinical chemistry. You can get one in hematology, immunohematology, let me see, hematology, immunohematology. There's a couple other ones too that are coming to me right now. Credentialing and certification, you will need to take additional continuing education classes as you go to keep your certification. And there's also licensing in certain states. Right now, when I'm recording this, Wisconsin is not a licensed state. Minnesota and North Dakota are. There are some that are, some that aren't. I have a feeling we will be. Other allied health personnel, you've all heard of phlebotomists, and you'll be taking a phlebotomy course next quarter. This phlebotomy course does not allow you to go take the boards to become a certified phlebotomist, but I guarantee you every student that I have who's applied for a phlebotomy job, who has taken the phlebotomy course, gets the job because of the phlebotomy experience that we have given them. So you don't need to have that degree after your name to become a phlebotomist. Medical assistants are very important. They are the ones that when you go to the doctor's office, they check you in, they take your history, they take your blood pressure, they give the information to the physician, and things like that. Physician office laboratory technicians are kind of I refer to them as an MLT, medical assistant, phlebotomist, kind of all tied in one. Point of care technicians are important. They monitor all the point of care testing. Other people that we come across on occasion, paramedics, nursing staff, clinical laboratory assistants, and diagnostic molecular scientists, which I don't see a whole lot of those. Usually they're med techs. So again, very important to maintain the highest standards of practice with honesty, integrity, and reliability. One of the things that I tell all my students is I'm not going to let you graduate unless I trust you to do laboratory testing on my mom, dad, and husband and children. That is my golden rule. So if I find you cheating on tests, handing another student's homework, oh, believe me, we see that a lot and we can find out. So we have ways of finding that out. If it's the same assignment that already handed in once, the system flags us, even if there's half of it that's similar. If you are cutting corners in the lab, doing things sloppy, not taking your time, just writing things down, not really caring, making a lot of transcription errors between writing things down, those are things that I'm going to watch for and train you with as we move forward. Because if I, again, don't trust you to draw blood and do testing on my kids, that is a big reason for me to not let you graduate. I want all of you to be phenomenal techs, and I want to trust all of you to do these things on my kids. And every single lab tech that has graduated from this program here at Rasmussen, I would let any of them do anything on my children. That is how awesome, or the level of ethics I've held them to. You have a duty to the patients, your profession, and colleagues in your society. So again, we want to hold those levels of ethics to make sure that everything that we're doing is with utmost confidence. We do respect our patients and our profession and other healthcare professions as well. Sometimes it can be kind of hard. Everybody thinks that their profession is better than the other. Sometimes nurses think they're better than lab techs think they're better than nurses, doctors think they're better than everybody else. But in all, you need everybody. There's not one person in this world that can do everything. So you always have to take a step back and realize that. Sometimes when things get dicey when you're working and you have one department yelling at you, might make you not feel like you're as good as another department. Always sit and think that you are just as important as everybody else. Okay, so we need to respect the other professions just as though they're expected to respect us as well. Professionalism is huge. As you move through these courses, you're going to start being graded on professionalism. Okay, inside and outside of class. I talked about the Facebook in the class, coming into class, talking about drama that's going on the outside of your life. These are all things that are with professionalism. So if you're coming into class, you're saying, oh my gosh, I got so drunk this weekend, I totally fell down the stairs, I got bruises on my face. I mean, I could go on and on with different examples. Those are not professional things to do, okay? You need to know when to have a conversation in the right context. If we notice that some of the things you're doing, some of your mannerisms and things like that are less than professional, we're going to pull you aside and talk to you about it. And we're not doing it to be mean. We're doing it because we want you to be very successful in the hospital environment. Maybe you're not used to working in that environment. It's different than some other places that you may have worked. So we want to make sure that you are aware of your actions, especially with the patients. Professional organizations, I'm not going to cover a lot of those because you will be looking at some of those today with your laboratory assignment online. You have to do a little digging and learning about those on your own. So when we talk about different employment opportunities, I showed you that pie chart in the beginning. There's all different types of places we can work. It's not just a hospital laboratory. Although hospitals and clinics are where the majority of my students work, the government is another place you could work. You could work in universities. You look at me, I'm at Rasmussen College. The military, if you something you want to go into, of course, we need those overseas as well. Research, there's always people doing research, hiring lab techs for that. I would say you'd probably have to work in like Madison or something to be able to do some serious research. Public health and sales and service. So one of my adjunct instructors who taught urinalysis and phlebotomy is now a technical specialist for Siemens Corporation. They make chemistry analyzers, and she goes out and sets them up for hospitals that have just purchased them. Very cool job. All right, so I'm going to go ahead and close this and see if I can pull my own face back up here. I assume you guys can still see me. I don't know. Okay. Anyways, I thought there was a way to pull my, so I can see what I'm showing you here. Hold on. Maybe it won't let me change the size of my screen. All right, well, hopefully you can see this. If you can't, I'm truly sorry. Leah should have handed out a certifiedbackground.com sheet. So if you can see it, it looks like this. If you can't see it, I'm really sorry. Leah will show you what it is. It says Student Instructions for Rasmussen College, Green Bay. You need to show me by the end of this course that you have had at least your first and second hepatitis B vaccine. It doesn't hurt you to get your varicella and all those other things that are listed on the timeline. You need to go in and scan and download those to a Dropbox within Certified Background Check. You are going to get points for those throughout various weeks throughout the quarter. Leah has also given you the sheet that has those the time frame on there, week 1, week 2, week 3, week 4, etc. So please, please, please make sure that that you do this, okay, in the time frame allotted. Everything is described on this sheet, okay? With that, that's really all that I have to go over with you guys today. I look forward to meeting you guys week 3. You'll be watching a PowerPoint from me for week 2 as well, because it's easier for me to do it than to have Lena do it. But I'll do that for you week 2, and then hopefully, not for sure, but hopefully I'll be back week 3 unless I'm having some issues, then you'll have Leah again. So with that, thanks a lot, guys. See you on the PowerPoints for week 2.